Guys, my presentation is on prolapse uteruses in cows. Definitions are the abnormal positioning of the uterus after calving. Usually occurs when the uterus is outside of the body. Complete prolapse is when the uterine horns also come out. Factors are during the birthing process, injury or irritation of the external birth canal, severe strain during labor, excessive pressure when pulling calf out, and non-calving is nutrition problems such as low calcium, magnesium, and protein in the blood. Generally, poor body conditions as well. Species most commonly seen in is cattle. The most common is dairy cattle, can occur in beef cattle, occasionally with hypocalcemia. Most commonly seen in Herefords, not real common in heifers, and is rare in sows, mares, bitches, queens, and rabbits. The signs and symptoms will hang below the hocks. Cow will likely step, lay, or kick the soft tissue, which risks rupturing an artery, can easily become infected, bruises easily, and can happen up to several hours after calving. So my personal experience with it is we had a calf last year at my grandpa's farm that had gotten a prolapsed uterus. My mom called the Athens vet. While we waited for him, he instructed us to dump water on the uterus while we waited for him. Once he got there, he had us get a warm, soapy bucket of water and 2 buckets of regular water. While we were getting the water, he put a jugular IV into the cow. I think it was just saline solution, but the cow was dehydrated. He cleaned the uterus really well, and he pushed the uterus back into the cow. He struggled a little bit because as he was pushing it in, the cow thought she was still having contractions, so she would push against him. Finally, he got the uterus back into place, but it was twisted, so he had to untwist it. After he was done, he put 3 stitches in the cow's vulva to stop her from pushing it out again. The cow died 2 days later. I think it was either from stress or infection, and the calf ended up getting scours and dying as well. Procedures. It's considered a medical emergency. It puts the cow at risk for shock or death by blood loss. Either amputation or reduction is done for this. The prognosis is the cow generally survives. There's a chance of secondary infection, which will stop the cow from being bred back. After one prolapse, it is a good chance that we'll have another. The treatment is there are 2 ways to treat it, reduction or amputation. Extreme cases, cows may have hemorrhage and suffer intense shock and will be euthanized. Considerations on which method to take. The placenta, if it has separated from the uterus or if it is still attached and needed to be removed. If it is full of dirt, it will interfere with reduction. Trauma, if there's severe trauma to the uterus, you would amputate. Trauma or exposure could devitalize the uterus. It could cause further problems when it's placed back inside. Gross hemorrhage, it can occur when the animal is scared and unable to be restrained. If there is a lot of hemorrhaging, amputation is the best option. Treatment. If treatment is reduction, placenta is removed, endometrium is cleaned very well, lacerations are fixed, and it is placed back into the right position back inside the body. If amputation is the treatment, the uterus is removed. So it's basically giving the cow a hysterectomy. During treatment, if uterus is not positioned correctly, it can cause bloat in the rumen, which can make it difficult for a reduction. Prevention, there is no guarantee way to prevent it. Reduce the risk is get cows in a standing position after birth, especially if calf is pulled to assist the mother. Here are my citations, and then here's a picture of my baby.